On the morning of May 29, 2025, the halls of CHU-Yalgado, Ouédraogo, CHU-Yalgado, in Ouagadougou hummed with quiet excitement. Inside the sterilized operating theater, Professor Nay Zongo, the hospital's chief oncologic surgeon, readied his team for a groundbreaking operation. This was to be the first breast graft, a form of breast transplant, ever attempted at CHU-Yalgado. CHU-YOBF.org. CHU-Yalgado is Burkina Faso's premier referral hospital for cancer care. WJSO, biomedcentral.com. And its general surgery unit serves as the national reference for breast cancer. As morning light filtered through the windows, surgeons scrubbed in and nurses arranged instruments. The air was thick with anticipation. After years of preparation, the hospital was on the brink of making history. The patient's journey. The beneficiary of this historic surgery was Esti, a Ouagadougou woman in her 40s and mother of 3. CHU-YOBF.org. 5 years earlier, during a prenatal visit in 2020, she had discovered a hard lump in her right breast. CHU-YOBF.org. Alarmed, she was referred to CHU-Yalgado. There she endured biopsies, a scan and mammogram, and then the rigors of chemotherapy and radiotherapy. Ultimately, the cancer led to a radical mastectomy. By 2021, Esti had achieved full remission. CHU-YOBF.org. But the physical loss haunted her. "I felt like a piece of me was gone," she later confided. Now, 5 years on, Esti's name appeared on the list of candidates for CHU-Yalgado's third annual free breast surgery campaign. From May 28 to 30, 2025, a regional health initiative was taking place at the hospital, a 3-day marathon of free breast cancer care and reconstruction. 22 women, many of them indigent or internally displaced, had been selected to benefit from surgeries and checkups. CHU-YOBF.org. Esti, still young and healthy aside from her breast loss, had been included specifically for reconstruction. For her, the campaign was a lifeline. As she prepared for the operating room, memories of the last 5 years flashed through her mind: the terror of the diagnosis, the loneliness of chemotherapy, and the longing to feel whole again. The surgical breakthrough. When the scheduled hour arrived, Dr. Zongo's team gathered around. The plan was a deep flap reconstruction, a complex microsurgical procedure. In this technique, surgeons harvest a single block of skin, fat and blood vessels from the lower abdomen, preserving the deep inferior epigastric vessels, and transplant it to the chest. Sidwea.info. The transferred tissue would be reshaped into a new breast mound, while the tiny blood vessels, barely a few millimeters wide, were sutured to the chest's internal mammary artery under the operating microscope. For hours, the team worked with painstaking precision. They first took as a single piece the skin and fat of the lower belly, vascularized by the deep inferior epigastric artery, as Professor Zongo explained. Sidwea.info. Next came the delicate step, connecting those donor vessels to the internal mammary vessels behind the ribcage. In his words, the microvascular anastomosis allowed revascularization of the graft, whose reshaping then gives a breast to replace the one lost during cancer surgery. CHU-YOBF.org. Sidwea.info. A side effect of the procedure was an unintended tummy tuck, abdominal tissue removed for the graft tightened Esti's belly as well. After many tense hours, the team completed the reconstruction and closed the wounds. All went smoothly. The operation went very well, and the patient is doing perfectly fine, Zongo later reported. Sidwea.info. Esti was moved to recovery, smiling through tears as she realized the ordeal was over. In her heart, she felt something new taking shape, literally and figuratively. International collaboration and support. This surgery was not an isolated event, but part of a larger international campaign. From May 28 to 30th, CHU-Yalgado hosted specialists from 10 countries, 9 African nations, and France for a week of breast cancer surgeries and training. CHU-YOBF.org. Sidwea.info. In the conference room the day before the operations, Burkinabe surgeons, nurses, and visiting doctors sat shoulder to shoulder, discussing patient schedules and techniques. Among them was Dr. Golda Juliette Romano, a renowned French plastic surgeon from the Gustave Roussy Cancer Institute. CHU-YOBF.org. Romano's presence exemplified the South-North collaboration. She assisted with operating and taught skills, while local teams shared their deep experience with regional patients. Together, the team would treat 22 women during the campaign. CHU-YOBF.org. These were some of Burkina Faso's most vulnerable patients: mothers, workers, and even internally displaced persons, all of whom had survived breast cancer but needed reconstructive care. The campaign was made possible by generous partners: the Orange Burkina Foundation, Burkina's National Pharmaceutical Procurement Agency, CAMEG, and the Ministry of Health all provided funding and logistical support. CHU-YOBF.org. Through their backing, every procedure and hospital stay was offered free of charge to the patients. In this bustling atmosphere, surgeons scrubbing and exchanged proud glances. They were pioneers pushing the boundaries of regional medicine. A milestone for West Africa. Esty awoke in the afternoon surrounded by applause and relief. For her, the new breast sitting on her chest was tangible proof that her body had been made whole again. But the significance went far beyond one patient. This successful surgery marked only the second time a breast transplant had ever been done in Burkina Faso. The first took place in Leo in October 2024, also under Zongo's guidance. Sidwea.info. CHU-YOBF.org. It demonstrated how far CHU-YO has come, from relying on foreign teams in the past to now leading complex oncologic and reconstructive surgeries themselves. This proves the growing skills of Burkinabe surgeons in a field still hardly accessible in the subregion, as one commentator noted. Sidwea.info. For women recovering from breast cancer, access to reconstruction is life-changing. Studies have shown that post-mastectomy patients who receive reconstruction often experience significantly better psychosocial outcomes, including higher self-esteem and lower anxiety and depression, than those who do not. PMC.NCBI and LM.NIH.gov. PubMed.NCBI and LM.NIH.gov. In practical terms, Esty felt this almost immediately. When she later saw her reflection, she burst into sobs of joy. Her body felt like hers again, and with it came the confidence she feared she had lost. Surrounded by the smiling surgical team, she understood the full weight of the day's success. This was not just her triumph, but a beacon of hope for many women. At CHU-YO, a new chapter had opened, one where surviving cancer could also mean reclaiming one's wholeness and future. Sources: news reports from CHU-Yalgado, Ouédraogo, CHU-YO Hospital, and Sidwea confirm the details of the surgery and campaign. CHU-YOBF.org. Sidwea.info. Sidwea.info. CHU-YOBF.org. Studies on breast reconstruction highlight its psychological benefits. PMC.NCBI and LM.NIH.gov. PubMed.NCBI and LM.NIH.gov. Underlining the profound impact of this milestone for cancer survivors.